which was one of the hardest hit hospitals in this country, is in my district, and the facility was at the heart of this epicenter. And the impact COVID-19 has had on our communities of color, and particularly Asian, Black, and Latino, Native American throughout this country, has been really troubling. Asian Americans were impacted early on, not just by the virus of the coronavirus, but by the virus of discrimination and hatred. And I stood with this exact group of leaders nationally as they stood shoulder to shoulder with the AAPI community to condemn discrimination against Asian Americans. The CDC says that Asian Americans' rate of hospitalization and deaths is almost 1.5 times more than whites. And so we've seen that this pandemic exacerbated already existing vulnerabilities, inequities, disparities, particularly in access to healthcare, and including language barriers, financial obstacles, etc. We must work together, as our governor said, to ensure that immigrant and minority communities have equal access to the COVID-19 vaccine, that there is a fair, effective, and equitable distribution, that communities of color know when and how to get this vaccine, and there must be engagement and outreach with local grassroots groups, faith-based organizations, and nonprofits to assist with getting this information out. One of the things that I was concerned about, and I was proud to partner with the governor last week, and he really led the charge in working with the Health and Human Services and the CDC director to ensure that information